If you're over 65, getting blood work isn't just a routine checkup anymore, it's crucial for catching serious conditions early. But I see seniors making the same critical mistakes that can throw off their results completely. One wrong move and your doctor might miss early signs of heart disease, diabetes complications, or even cancer. Or worse, you might get put on medications you don't actually need. I'm Dr. David Wang, a geriatric specialist who's been helping seniors navigate healthcare for over 15 years. In my practice, I've reviewed thousands of lab results, and I've noticed that seniors face unique challenges that younger patients simply don't have to worry about. Today, I'll share the 10 mistakes I see my patients make before blood tests, and the simple fixes that could save your life. Before we dive in, if you're serious about taking control of your health as a senior, make sure to subscribe to Elderly Health Central and hit that notification bell. I share senior-specific medical advice every week that you simply won't get from general health channels. Most of my subscribers tell me this information has literally saved them from medical errors and unnecessary treatments. Okay, let's get into these critical mistakes. The first mistake is not adjusting medication timing for your age. I had a patient, Margaret, who's 73, and she always took her blood pressure medication at 5 a.m. for her 7 a.m. blood test because she thought that was fasting. But here's what most people don't know: as we age, our metabolism slows down, and medications stay in our system longer. When Margaret took her blood pressure pill just 2 hours before her test, it artificially lowered her blood pressure reading and affected her kidney function markers. Her doctor almost doubled her medication dose, which could have been dangerous. The problem is that senior bodies process medications differently than younger adults. Our liver and kidneys work more slowly, so drugs have a longer half-life. The solution? If you're over 65, talk to your doctor about adjusting your medication timing before blood work. For most blood pressure medications, you might need to skip the morning dose or take it after your test. For diabetes medications, the timing is even more critical. Always ask your geriatrician specifically about medication timing. Don't just follow the standard fasting instructions meant for younger patients. Mistake number 2 is ignoring what I call the senior fasting challenge. Frank, one of my 78-year-old patients, couldn't understand why he felt dizzy and nearly fainted during his blood draw. He had followed the fasting instructions perfectly: no food for 12 hours, just water. But Frank made a common senior mistake. As we age, our bodies become less efficient at maintaining blood sugar and hydration levels during fasting. Our kidneys don't concentrate urine as well, and our glucose regulation isn't as tight as it used to be. For seniors, standard fasting can be genuinely dangerous, especially if you have diabetes, take diuretics, or have any heart conditions. Here's what I recommend for my senior patients. First, never fast longer than 10 hours unless specifically instructed. Second, drink plenty of water the day before, aim for 6 to 8 glasses spread throughout the day. Third, schedule your blood work as early as possible, ideally between 7 and 8 a.m. And fourth, bring a snack and eat immediately after your blood draw. If you have diabetes or take medications that can cause low blood sugar, ask your doctor if you should modify your fasting time. Sometimes, we can get accurate results with just 8 hours of fasting in seniors. Mistake number 3 is what I call the supplement stack problem. Rose, an 82-year-old patient, brought a grocery bag with 23 different vitamins, minerals, and supplements to our appointment. She said, "Doctor, I didn't think these mattered because they're natural." This is a huge problem I see with seniors. The average person over 65 takes 4 to 5 prescription medications, but many also take 8 to 12 supplements. Unlike younger adults who might take a basic multivitamin, seniors often take calcium, vitamin D, B12, fish oil, probiotics, joint supplements, and more. Many of these can significantly interfere with blood tests. For example, biotin in hair and nail supplements can make your thyroid tests look completely wrong. High-dose vitamin C can interfere with glucose testing. Iron supplements can affect liver function tests. Even something as innocent as calcium can interfere with certain hormone tests if taken too close to your blood draw. Here's my solution: create a complete supplement list with dosages and bring it to every appointment. Stop all supplements containing biotin for at least 3 days before any thyroid testing. For other supplements, ask your doctor which ones to hold and for how long. Generally, I recommend stopping all supplements 24 to 48 hours before blood work unless they're medically necessary. And please, don't restart them until after your blood draw is complete. Mistake number 4 is testing during seasonal health changes. Every winter, I see the same pattern in my patients over 70. Their vitamin D levels plummet, their depression scores go up, and their inflammatory markers increase. But many seniors don't realize that seasonal changes affect their lab values much more dramatically than in younger people. I had a patient, George, who gets his annual physical every January. Year after year, his cholesterol would spike, his vitamin D would be low, and his mood questionnaire showed signs of depression. His doctor kept adjusting medications based on these winter readings. But when we moved his testing to September, his numbers were completely different, and much better. As we age, our bodies become more sensitive to seasonal changes. We produce less vitamin D naturally, we tend to be less active in winter, and we're more prone to seasonal affective patterns. Our immune systems also become more reactive to weather changes, which can affect inflammatory markers in blood tests. My recommendation? If possible, schedule routine blood work during your good season, typically late spring or early fall for most seniors. If you must test in winter, make sure your doctor knows it's your off-season and discusses whether any concerning results might be seasonal. This is especially important for vitamin D, mood-related markers, and cardiovascular risk factors. Mistake number 5 involves mobility and access issues that younger patients don't face. Robert, a 75-year-old with cataracts, drove himself to the lab early in the morning when his vision was worst. He was so stressed about navigating the parking lot and finding the lab that his blood pressure was sky-high, and his stress hormones were elevated. This is more common than you'd think. Many seniors face challenges getting to the lab: vision problems, arthritis that makes early morning movement difficult, anxiety about driving, or public transportation issues. But stress from these challenges can significantly affect your test results. Stress hormones can elevate blood sugar, blood pressure, and inflammatory markers. Additionally, many seniors don't realize that physical strain from walking long distances in hospitals or medical buildings can affect certain tests, particularly heart markers and liver enzymes. I've seen seniors whose cardiac enzymes were slightly elevated simply because they had to walk from a distant parking spot while carrying heavy purses or medical bags. Here's what I recommend: arrange transportation if driving is stressful. Ask family members to drive you, use medical transport services, or see if your doctor's office has recommendations. Call ahead to ask about parking and wheelchair accessibility. Arrive 15 minutes early so you're not rushed. Bring only essential items to reduce physical strain. And most importantly, tell the lab staff if you've had any physical stress getting there. They can note this in your file so your doctor can interpret results appropriately. Mistake number 6 is overlooking how sleep medications affect your blood tests. Dorothy, an 81-year-old patient, couldn't understand why her cortisol levels were completely abnormal. She had been taking Ambien for years and didn't think to mention it because it's just for sleep. Sleep problems are incredibly common in seniors. Over 50% of people over 65 have chronic sleep issues. Many take prescription sleep aids like Ambien, Lunesta, or even older medications like trazodone. Others use over-the-counter sleep aids containing diphenhydramine. But these medications don't just affect sleep. They can significantly impact hormone levels, liver function, and even blood sugar control. Sleep medications can suppress your natural cortisol rhythm, which is crucial for many hormone tests. They can also affect growth hormone, thyroid function, and inflammatory markers. Some sleep aids affect liver enzymes, making it look like you have liver problems when you don't. Even melatonin, which seems harmless, can affect certain hormone tests if taken in high doses. My solution? Always tell your doctor about every sleep aid you use, including over-the-counter options and melatonin. For hormone testing, especially cortisol, thyroid, or growth hormone, ask if you should stop sleep medications temporarily. Usually, we recommend stopping for 3 to 5 days before testing, but this depends on your specific situation and what medications you're taking. Never stop sleep medications suddenly without medical supervision, especially if you've been taking them long-term. Mistake number 7 is not factoring in chronic condition flare-ups. Harold, a 79-year-old with rheumatoid arthritis, came in for routine blood work during a particularly bad arthritis flare. His inflammatory markers were through the roof, making it look like he had a serious infection or his arthritis was much worse than usual. As we age, most of us develop at least one chronic condition: arthritis, diabetes, heart disease, or autoimmune conditions. These conditions have flare-ups and quiet periods, but many seniors don't realize that testing during a flare can dramatically skew results. Arthritis flares elevate inflammatory markers like CRP and ESR. Diabetic complications can temporarily worsen kidney function tests. Even conditions like IBS or diverticulitis can affect liver enzymes and inflammatory markers. The challenge is knowing when to delay testing versus when to proceed. Sometimes, we actually want to test during flares to see how your body is responding. Other times, flare-related inflammation can mask or exaggerate other health issues. Here's my approach: if you're having a flare of any chronic condition, call your doctor before your scheduled blood work. Ask whether the flare might affect your specific tests. For routine monitoring of stable conditions, it's often better to wait until the flare calms down. For monitoring the flare itself or checking medication effectiveness, testing during the flare might be exactly what we need. The key is communication. Don't just show up for blood work during your worst week without letting your medical team know what's happening. Mistake number 8 is misunderstanding normal ranges for seniors. Eleanor, an 85-year-old patient, panicked about her cholesterol numbers because they were high according to the lab report. But what she didn't know is that cholesterol goals are different for seniors, especially those over 80. This is a huge source of confusion and anxiety for my senior patients. Standard lab ranges are typically based on younger, healthier populations. But as we age, what's normal and what's optimal can be very different. For example, slightly higher cholesterol might actually be protective in seniors over 80. Blood pressure targets are different for older adults. Even blood sugar goals are often relaxed in seniors to prevent dangerous low blood sugar episodes. Many lab reports flag values as high or low without considering age-specific recommendations. I've seen seniors panic about numbers that are actually perfectly appropriate for their age, and I've seen others ignore truly concerning values because they fell within the normal range. The solution is education and communication. Don't panic about lab values until you've discussed them with a geriatrician or your primary care doctor who understands senior health. Ask specifically, are these numbers appropriate for my age? Request age-adjusted interpretations of your results. If you're seeing multiple specialists, make sure they're all using age-appropriate targets for your conditions. And remember, the goal isn't to have the lab values of a 30-year-old. It's to have values that optimize your health and quality of life at your current age. Mistake number 9 is not preparing for multiple tube draws. At 82, William needed 8 different tests for his annual senior wellness visit: complete blood count, comprehensive metabolic panel, lipids, thyroid, PSA, B12, vitamin D, and inflammatory markers. That's a lot of blood, and William wasn't prepared. Senior blood work is typically much more comprehensive than younger adult testing. We're screening for more conditions, monitoring more medications, and checking more age-related markers. This often means 6 to 10 different tubes of blood, which can be challenging for seniors who may have smaller veins, take blood thinners, or have other circulation issues. Many seniors don't eat enough protein or iron, making them more prone to feeling weak after larger blood draws. Others take medications like warfarin or aspirin that can increase bleeding or bruising. Some have fragile skin that tears easily or veins that are hard to access. Here's how to prepare: eat a protein-rich meal the night before your test. Drink extra water for 24 hours before your appointment to make your veins more accessible. Wear a shirt with sleeves that roll up easily. If you take blood thinners, ask your doctor if you need any special precautions. Bring a snack and plan to rest for 10 to 15 minutes after your draw. If you have difficult veins, ask for the most experienced phlebotomist available. And consider scheduling blood work earlier in the week so you have time to recover before weekend activities. And finally, mistake number 10 is rushing back to normal activities too quickly. Patricia, a 77-year-old fitness enthusiast, went straight from her blood draw to her water aerobics class. By the afternoon, she was dizzy, exhausted, and her arm was severely bruised. Seniors need more recovery time after blood draws than younger adults. Our circulation isn't as robust, we're more prone to dehydration, and our bodies take longer to replace the blood volume that was drawn. Yet many active seniors underestimate this recovery time. Additionally, seniors are more likely to be on medications that affect bleeding or healing. They're more prone to blood pressure drops and more sensitive to volume changes. What might be a minor inconvenience for a younger person can be a significant stressor for an older adult system. My recommendations: plan a light day after blood work. Avoid strenuous exercise for 24 hours. Keep the bandage on for at least 4 hours and watch for signs of continued bleeding. Drink extra fluids throughout the day. If you feel dizzy or weak, sit down immediately and call your doctor if symptoms persist. And don't schedule important activities or driving long distances on the same day as extensive blood work. These 10 adjustments can mean the difference between accurate results that help you live your best life, and false alarms that cause unnecessary stress and treatment. Getting your blood work right the first time saves you from repeated testing, worry, and potentially inappropriate medical interventions. Drop a comment about which mistake surprised you most, and please share this video with any senior friends who have blood work coming up. Subscribe to Elderly Health Central for more senior-specific medical advice you won't hear anywhere else, and hit that notification bell so you never miss important health information. Next week, I'll be explaining the 5 blood tests every senior over 70 should demand from their doctor, tests that could catch serious problems years before symptoms appear. Remember, this information is for education only and doesn't replace personalized medical advice from your healthcare team. Thanks for watching, and I'll see you next time.